Good evening, everyone. I hope you're all well and I've been enjoying our first speaker. I have. My name is Astrid Fremau and I'm part of the Medical Affairs Department at Flen Health. Now, in what follows, I'm going to guide you through the results of a large-scale clinical evaluation of our product Flaminal. These results build further on data that we obtained and published in 2018. Now, time flies. Being already 5 years later, we thought it's about time we provide you all with an update. So this clinical evaluation of Flaminal follows on from the Jones and Oates publication of 2018, which included 356 patients. Now, in this updated evaluation, no more than 1,657 patients were included, who all applied Flaminal for the treatment of their wounds. Now, being applied with so many patients, we wanted to know about the performance of Flaminal, about its clinical effectiveness. To do this, we used the wound assessment framework TIME, which is the most commonly used wound assessment tool in Europe, which you will know. TIME as an acronym standing for tissue, infection, moisture, and edges, is a clinical decision support tool, which provides a structured approach to wound bed preparation. This publication is an example of real-world evidence that can be utilized to support evidence-based practice. It also includes some nice case studies, which Catherine will move on to in the next session. And yeah, real-world evidence that was very nicely discussed by Chris in the first presentation of this evening. Now let's have a look at the two key objectives of this clinical evaluation. So first of all, we wanted to emphasize the importance of accurate wound assessment using the framework TIME. And secondly, we aim to evaluate the continuous performance, the continuous clinical effectiveness of Flaminal in wound management. How did we do this? Well, we asked our UK district nurses to complete one evaluation form per patient to document the performance of Flaminal. This specific product evaluation was performed in the UK between February 2019 and November 2020. The questions on the form all related to the TIME framework, and following the collection of all evaluation forms, the data was analyzed, and the analysis included a statistical analysis using a standard binomial test. Now let's have a look into the results of this large-scale clinical evaluation. So as said, a total of 1,657 product evaluations were collected, which related to a very wide range of wound types. A couple of examples here on the slides. So these wound types included some of the most commonly treated wounds in the wound community, such as leg ulcers, pressure ulcers, and diabetic foot ulcers. About 2/3 of the patients use Flaminal Forte, which is, as you know, indicated for more highly exuding wounds, and that is thanks to its higher alginate concentration. Compared to Flaminal Hydro, here on the left, the blue one, which is indicated for low to moderately exuding wounds, and was used in 31% of the patients. Now, the other 3% of the patients used both, so both Flaminal Hydro as well as Flaminal Forte over the course of the wound treatment. Following the TIME framework, the first step is evaluating and managing the tissue. More specifically, the removal of fibrinous slough, of necrotic tissue. And here we saw that no more than 81% of the district nurses reported an improved wound bed upon using Flaminal. That result was also statistically significant. Another aspect when managing tissue in wound care is evaluating healthy granulation tissue, or tissue that is bright red, moist and granular in appearance. Over the course of the treatment, it was seen that 77.5% of the district nurses indicated an improvement in granulation tissue when using Flaminal. Also here, the result was statistically significant. From the T of time, we move on to the I, standing for infection. It was noted that upon using Flaminal, almost 73% of the clinicians reported an improvement in infection signs. Now, in this case, it's good to mention that when no infection signs were present at the start of the wound treatment with Flaminal, also the answer option no change, indicated here on the slide in yellow, is an important outcome, demonstrating the ability of Flaminal to prevent the wound from getting infected. When we then questioned the moisture management by Flaminal, we saw that no more than 82.6% of the district nurses indicated that the moisture was well managed using Flaminal. Now, given that approximately 2/3 of the treated wounds in this evaluation had moderate to high exudate levels, well, yeah, this outcome for Flaminal was critical. And then last but not least, the wound edges and the surrounding skin. Almost 70% of the district nurses indicated that the condition of the wound edges and surrounding skin had improved with the application of Flaminal. Also, this result was statistically significant. And here, again, when the wound edges and surrounding skin were healthy at the start of the wound treatment, the answer option, no change, here in yellow, is a good result, as you aim for or you want to maintain such healthy wound edges over the course of the treatment. 3 points of discussion still before it's time to conclude this presentation. First, a structured wound assessment is required at the initial patient contact with a documented holistic framework, including photographs, including measurements. As mentioned, this product evaluation and the data obtained with it build further onto the Jones and Oates publication of 2018. The results strengthen the outcome of 2018 publication and highlight the ongoing performance of Flaminal in addressing every aspect of the TIME framework. Then, thirdly, the questions asked in the evaluation all reflect an important factor in managing the barriers to healing, and the results shown are significant to relate to real-world practice, as well as to the need for a suitable and cost-effective dressing regime. To conclude then, sandwiching dressings or using multiple dressings to tackle the different aspects of wound care can cause, as you all know, complications in practice and will result in increased costs. That is why a dressing that on its own can address the many barriers of wound healing will undoubtedly benefit the patient, the healthcare professional, as well as the NHS in terms of cost effectiveness, in terms of ease of use. This large-scale clinical evaluation is, as said, an example of real-world evidence. It shows that Flaminal's versatile characteristics allow it to be used throughout the wound healing continuum, as it promotes autolytic debridement. Flaminal offers antimicrobial protection. It keeps the wound moist while offering absorption of excess exudate. And last but not least, it protects the wound edges of the wound. One last thing which I would like to mention is that we as a company, we keep on monitoring the performance and the safety of Flaminal and our other wound and skincare products on a continuous basis. If you feel you would like to contribute, or if you have specific suggestions or questions for us relating to your use of Flaminal, then please reach out. contact us, contact your local sales representative, and let us know what you would like to discuss with us. Because having such discussions with you, well, that is our guide moving forwards. And with that, my time's up. I hope you've all enjoyed the session, and thank you for listening.